Nigeria has been on the red list for a while, but people are still coming in. Hello guys, welcome back to my channel. My name is Tayo. In case you're new here, hi. Thank you so much for coming to my channel to watch my video. If you like what you see, please don't forget to hit the subscribe button and also the bell. And also to my returning subscribers, thank you so much for coming to watch my video again today. I really appreciate you all. So now on my videos, I'm mostly talking about videos about how to come to this country, the opportunities available for you. I'm giving you updated information about the happenings around coming to this country and how the laws are changing and opportunities that are coming up regularly. And I'm going to be updating you. That's why I'm doing this video now. Sorry it's a bit late because this information came out on the 14th of March. But yeah, I just want to talk about how it affects people that want to come into this country, and also talk about maybe different ways, the other ways that you could come in, you know. So keep on watching. So if that's what you want to see, please keep on watching. So guys, if you are new here and you haven't yet subscribed, please hit the subscribe button and also the thumbs up. Give me a thumbs up because that helps you to recommend the video to other people. Thank you so much for the other videos that you've commented on, and I'm getting to your questions. I'm going to answer some more questions that people have asked me. Again, I'll do it in another video and answer those questions. But I have a couple of videos in relation to other things that are on my channel, community work as a social worker. You can check that out, and yeah, all the information is there for you. I'll put also in the description box. Also guys, sometimes I see jobs that come up and I just put the link in my description box, so it's going to be towards the top so you see it. So make sure you check my videos. Any job that comes, like last week for instance, I saw some jobs on occupational therapy and I put them on the link. The people have probably applied now and all that, so I'll probably take that link down. But I always definitely put links in my description box about jobs that I see on my YouTube channel, and I put them on my YouTube channel, jobs that I see on Indeed and other recruitment websites. So guys, make sure you're following me, make sure you keep up to date, and I'll try as much as possible to keep you up to date with what's happening. I also have an Instagram page where I'll also be updating in my stories, so make sure you follow me there as well. I'll put my Instagram across so you can see. Thank you so much guys. So in this video, I want to talk about the latest happenings with the World Health Organization and their new policy that they came out with recently. So I'm just going to put it up for you to be able to see. It says WHO renews alert on safeguards for health worker recruitment. The WHO released today an updated WHO Health Workforce Support and Safeguards List 2023, identifying 55 countries as vulnerable for availability of health workers required to achieve the United Nations Sustainable Development Goal target for universal health coverage UHC by 2030. It talks about COVID and how COVID's disruption has resulted in rapid acceleration in the international recruitment of health workers, you know. So they're saying that people that are losing their personnel due to this international migration could be negatively impacted, you know, their health system negatively impacted and all that, you know. So two of the countries that I know have been added are Zambia and Zimbabwe, you know. Those are two of the other 8 countries that have been added from Africa, you know. So yeah, so it talks about where the other countries are, and I'll put the list of the countries so you can actually see, you know, the countries. I'll put the list so that you can actually see the countries. Yeah, I'll just put the list up now for you. And you have Angola. So these are all the countries. Got Angola, Benin, Burkina Faso. I'm not going to read all of them. Cameroon, Ethiopia, Gabon, Gambia, Ghana, Guinea, Nigeria is there, Niger, Mauritania, and all those other countries. And we definitely know that people have been coming in from these countries. We have Ghanaians coming in, and they have been on the red list for a while. Nigeria has been on the red list for a while, but people are still coming in. But what it is, based on ethical grounds, you know, the government of Nigeria, for instance, can say to the government of UK, all our doctors are leaving, many of our doctors are leaving, coming here, and we lack, you know, we don't have enough doctors in this country, and our health service is suffering. And then obviously the UK government on ethical grounds, even though they need doctors here as well, they probably have to, accept that. But people are still recruiting. You can apply directly. You can apply. There will not be an international widespread recruitment, but people are still applying individually, and they are coming, And also, apart from that, other ways are you can come in for a master's. You can come in for a master's in one of these healthcare courses. You can come in for a master's in nursing. You can come in for a master's in social work. You can come in for a master's in occupational therapy and other healthcare courses. As I said in my last video, there is a widespread need for healthcare workers, and people that have the right to live in this country who are still abroad can say, okay, I want to come back here. And I mean, we still have lots of British citizens still living in other parts of the world. Might decide I want to come back and live here, And so yeah, so that doesn't stop people from coming. So other ways is you can come in and do a degree, as I said. You can come and do a master's. You can come and do a PhD, even a BSc again. In a healthcare course that's like 3 years, like social work, for instance. I've talked about that in my other video. You can watch it, And yeah, there's quite a lot of information that is right. It's very helpful. So guys, that shouldn't discourage people. But one thing I would say is that if you're thinking of coming, now is the time to make up your mind and plan, because things change every day. The UK government is talking about reducing migration and all that. So things change regularly. I live in the UK, so I know about UK. I'll be talking about other countries eventually when I have the information, and all that. But I'm not just going to say, I don't know. If you want to come, the door is still open, maybe not as wide open as before, but you can still you're still able to come into the door. So guys, anyway, just don't let that discourage you. Just try, you never know. Go online, go on Indeed, and there are jobs there you can apply for and you can come in. So guys, that is just my take on the whole issue. Though it's been said and it's unfortunate, they have to abide by it on ethical grounds, because yes, they have to make sure that the countries that these doctors and nurses and healthcare workers are living, also have enough, So, but at the same time, they're also going to care about their own healthcare service. That's just the truth. They let the truth be told, So yeah. So guys, anyway, thank you so much for watching this video, and I hope to see you in my next one. Please share this video. You don't know who it will help. Just give me a thumbs up. And also, please don't forget to subscribe for more and hit the bell so you'll be notified. Thank you so much for watching my video, guys. I'll see you in the next one. Bye.